In this video, we are going to discuss a case of meningitis. And in this case, the patient comes with the chief complaints. And the chief complaints are, the first one is the fever, headache, neck stiffness, and the fourth one is the difficulty in waking up and the mental confusion. So all these four are the chief complaints of the patient. And also that is CSF fluid examination was done through lumbar puncture, and also that is some of the following abnormal reports were obtained. And why abnormal reports? Because all the reports which are obtained, they were not under the normal range. So therefore these are the abnormal reports which were obtained through the laboratory investigation of the CSF fluid. So all these situations I'm going to discuss. Basically, what is meningitis and how the symptoms that is occur in the patient, and how are the abnormal values also occur in the CSF fluid. So friends, so first of all I'm going to explain what are meninges or meningeal layers. So see this diagram. So if you see this diagram, you can relate that there are some layers which are present between the brain and the skull bone, and these layers are pia mater, arachnoid mater, and dura mater, and all these layers, they form meningeal layers, or these layers are also known as meninges. If you want to know what is meningitis, when these layers, they are affected or damaged, and the inflammation of these meningeal layers is known as meningitis. So this is the main basic concept of meningitis, that all the meningeal layers like pia mater, arachnoid mater, or dura mater, they are affected or they are damaged due to their inflammation. So simple that I have written that the layers, so therefore the layers present in the so here present between the brain and the bone of the skull. The layers, so here present between the brain and the bone of the skull, and the following layers are pia mater, arachnoid mater, and dura mater, and these layers, they are known as meningeal layers. And in meningitis, there is abnormal situation that in meningitis these meningeal layers are damaged. So this is the main basic concept of meningitis. Now I am going to explain the reasons for the occurring of the chief complaints or the symptoms in the patient. And the chief complaints of the patient are, the first one is the fever, second one is the headache, and the third one is the neck stiffness, and the fourth one is the mental confusion and difficulty in waking up. So all these four are the chief complaints of the patient, and I am going to discuss now. Friends, so now I am going to explain what are the causes of the chief complaints of the patient. So now the chief complaints of the patient are high fever, severe headache, neck stiffness, mental confusion, and difficulty in waking up. So now I am going to explain the reason for the high fever. Now the body temperature of the patient is above 38 degrees Celsius, but the normal body temperature range, that is for a 20-year-old boy, is 36.1 to 37.2 degrees Celsius. So therefore, so you can notice that the body has the high temperature, and due to this high temperature of the body, so here fever is caused. But now how that this temperature rising down? So friends, as you have already understood that this meningitis caused by a bacterium or a virus, and this bacterium or virus, they are considered as foreign antigens. Now so that this foreign antigen that is enters our body, and then after entering in our body, that is it enters our brain, and then in brain it causes infection. Due to the infection of the brain, so here that is inflammation of the meningeal layers occurs. Now the immune response of our body is also activated. Why? Because foreign antigen has entered our body, and also that is our immune response, the immune response of the body, so here raises the body temperature so that the immune response or the immunity can act against this foreign antigen and the foreign antigen can be killed. So why the fever occur? Because of the rise in temperature due to the appearance or the coming of the foreign antigen. So see that, so here a body temperature of the patient and normal body temperature range for 20-year-old boy. Now see that a meningitis caused by bacteria or viruses, and this here that is antigens causing meningitis, they are considered as foreign antigens because they don't belong to our body. When these foreign antigens enter our body, then the immune response of our body gets activated and the body temperature raised by the immune response in order to fight against the foreign antigen. So you can relate that due to the rising of the body temperature, fever is caused. So the main reason for the fever cause is that a rise in the body temperature because of the coming or the attack of the foreign antigens. So now next I am going to explain the cause of the headache. So now before knowing headache, that is, you already know that in brain that there are three meningeal layers, basically that three meningeal layers which protect the brain actually. And the three meningeal layers are pia mater, arachnoid mater and dura mater. Now, so this is a normal thing, but as you already know that in meningitis, that is all these layers, they are inflamed or damaged. Now due to the inflammation or the damage or destruction of all these meningeal layers, all the nerve cells which are present in the brain, they get destroyed. And due to the destruction of all these brain nerve cells, so here headache occurs. See what I have written. The three meningeal layers, that is which cover or protect the brain and the spinal cord, are pia mater, arachnoid mater, dura mater, and these meningeal layers get damaged or destroyed in a meningitis as inflammation occurs in the meningeal layers. Due to the inflammation of these meningeal layers, the nerve cells of the brain get destroyed. Due to the destruction of these brain nerve cells, so here headache occurs. Now, as you also know that in this case the patient is sensitive to light, and also the headache also increases or occurs when any light is injected towards the patient. So you can relate that this headache is also related or accompanied with the light, and this shows that the patient is also that is sensitive to the light. So therefore that is headache is related to the light, and that type of headache which increases or related to light is also known as migraine headache. So this is for extra information. See that since the headache that is related to or accompanied by light sensitivity, and this type of headache is also known as migraine headache. So therefore if you want to know what is the reason for the headache, so this is the main reason, that is the destruction of the brain nerve cells done. And why destruction of the brain nerve cells done? Because of the inflammation of the meningeal layers. So now I am going to explain the reason for the mental confusion and difficulty in waking up. As you have already understood that in meningitis, there is all the meningeal layers, they are damaged and they are inflamed, and also they due to inflammation of all these meningeal layers, that is the nerve cells of the brain get destroyed, and as a result of the destruction of these nerve cells of the brain, that is the nerve coordination is not done. So therefore a mental confusion occurs as the proper nerve coordination is not done and it is affected. So see that, so I have written the reason for the mental confusion, that the inflammation of the meningeal layers done, and this inflammation of the meningeal layers so here destroys the nerve cells of the brain. As a result, the proper nerve coordination among the nerve cells of the brain get affected. So therefore mental confusion occurs. And you also know that in our brain there is an alertness center, and that brain's alertness center is also affected due to inflammation of all the meningeal layers. Now since this brain's alertness center, so here maintains sleep wake cycle, and also that is maintains your that is activeness. So as this brain's alertness center is affected, it is damaged, so sleep wake cycle not maintained, and also lethargy occurs. So this is a reason for difficulty in waking up. So see that the inflammation of the meningeal layers affects the brain's alertness center. As a result, that is lethargy occurs, and also sleep-wake cycle affected, and due to this, so here there is difficulty in waking up occurs. So therefore you can relate that this, so here headache and also mental confusion, they occur due to the both region inflammation of the meningeal layers, and also there is destruction of the brain nerve cells. And here that is difficulty in waking up. Why occurs? Because there that the brain alertness center is reduced, and it is that the brain's alertness center is affected and it is damaged. So these are the regions for a mental confusion and difficulty in waking up. So now next region is about the, so here you can relate that is the neck stiffness. Now before knowing neck stiffness, that is you should know the some of the neck extensor muscles like trapezius muscle, levator scapulae, splenius capitis, semispinalis capitis. All these are the extensor muscles of the neck. They have very important functions, so here related to the neck. First function is that this, so here extensor muscles support the cervical spine. Second, all the, so here movements of the neck like flexion, extension, rotation, that is all these neck movements, so here done due to the support and the proper function of these neck extensor muscles. So see that I have written all these points. So that is a neck extensor muscles provide stability and control the, so here neck movement properly like flexion, extension, and also and this neck extensor muscles support the cervical spine, and this neck extensor muscles prevent the head from tilting forward. So these are the main basic functions of the extensor muscles of neck. And layers of neck extensor muscles, the first layer, so first layer, second layer, third layer, so this is a superficial layer and this is the deepest layer. So therefore, so layers are that is upper trapezius muscle and levator scapulae muscle, splenius capitis and semispinalis capitis. So these are the different layers of neck extensor muscles. Now, and also if you notice that out of all these neck extensor muscles, trapezius muscle is the most important. Most important, that means it is the main primary extensor neck muscle. Why? Because it is the largest neck muscle and it lies superficially. So therefore it is considered as a primary extensor muscle and it contributes that is more in the, so here support of the cervical spine, and the support of cervical spine is also very important. So this is a primary extensor muscle. So see that I have written that. So here trapezius is the largest neck extensor muscle and it lies superficially and it is the main primary extensor neck muscle. Okay. Now friends, see this diagram. So if you see this diagram, you can relate that the accessory cranial nerve, so here supplies trapezius muscle, and this accessory cranial nerve is a cranial nerve 11, and this accessory cranial nerve, so here comes or also located in the subarachnoid space. And you know that subarachnoid space, and see this diagram. So here subarachnoid space is located between pyometer and arachnoid mater. And you know that in case of meningitis that this pyometer, arachnoid mater and dura mater are affected and they are inflamed. So as a result, subarachnoid space also gets affected. Now due to the damage or infection in subarachnoid space, the accessory cranial nerve which is located in that subarachnoid space also gets affected. As a result, the nerve supply of the trapezius muscle is affected. So therefore that is the proper functioning of the trapezius muscle not done, and then what happens, that is the neck extensor muscle not done. So therefore many problems related like occur during a neck movement, and also neck stiffness occurs. See there. So here that is trapezius muscles are supplied by cranial nerve 11, and this cranial nerve, so here comes from the subarachnoid space, and subarachnoid space, so here located between the pyometer and the arachnoid mater, and this subarachnoid space is affected due to the inflammation of the meningeal layers pyometer and arachnoid mater, and accessory cranial nerve is affected, and also trapezius muscle function is affected. As a result, so here neck stiffness occurs. So this is a summary. see that is the inflammation of the meningeal layers done, so therefore that is subarachnoid space gets affected, and also accessory cranial nerve in subarachnoid space also gets damaged, so therefore trapezius muscle gets affected and therefore neck stiffness occurs. So this is the main reason. Now friends, now there is a sign that is Brudzinski sign, and this Brudzinski sign can also decide whether the patient has meningitis or not. Now by seeing the diagram, that is, you can relate that the positive Brudzinski sign is a sign when the neck of the patient is flexed by the examiner, then automatically, that is involuntary, that is flexion of knee occurs. So this is what I have written. So here a positive Brudzinski sign, involuntary knee flexion done when the knee flexion occurs, and negative, no knee flexion occurs when the knee flexion done. So this is the your main concept of Brudzinski sign, and also you can read from this also. That is. Now we did the lumbar puncture test in order to examine the CSF fluid of the patient, and CSF, that means cerebrospinal fluid, and on doing the investigation of the CSF fluid we get abnormal results. Abnormal results in the mean that all the reports that were obtained, like the protein content in the CSF fluid, glucose content in the CSF fluid, and a number of cells present in the CSF fluid, all these reports were abnormal. That means that these reports so here indicated that there is no normal, the person has meningitis. So the first one is about that is high protein content, second one is that is low glucose content, and the third one is that is neutrophils in the CSF fluid, and the fourth one is that here causative organism present in the CSF fluid. So all these are the abnormal reports. Now I am going to discuss about the laboratory investigations. Now see that the protein content in CSF of the patient is 70 milligram per deciliter, whereas that is normal protein content in CSF fluid is 15 to 45 milligram per deciliter. So you can observe that the protein content of the CSF fluid of the patient is greater than the normal. Why? Because that this meningitis is caused by bacterium, so therefore acute pyogenic meningitis. And you also know that in the cell wall of bacteria, so therefore that is proteins are present, like lipoproteins, liposaccharides. So there are different types of proteins present in the cell wall of the bacteria, and therefore that these proteins also contribute to additional protein content of CSF fluid, and as a result that is protein content in the CSF fluid of the patient increases and it is greater than the normal. So see that what I have written. So see that the protein content in CSF fluid is 70 milligram per deciliter. It is for the patient, but a normal protein content in CSF fluid is 15 to 45 milligram per deciliter. Now therefore acute pyogenic meningitis caused by bacteria, and this bacteria present in CSF fluid, since the cell wall of this bacteria contain proteins, and these proteins also contribute to additional protein content in CSF fluid, and therefore protein content in CSF fluid of the patient is greater than the normal range. So this is the reason for the abnormal protein content. Now also I am going to discuss you about the abnormal glucose content. See there. So the glucose content in the CSF fluid of the patient is 24 milligram per deciliter, but normal glucose content in CSF fluid is therefore that 50 to 80 milligram per deciliter. So you can notice that there is a reduction occur. So friends, as you already know that in CSF fluid bacteria are present, and these bacteria have cell wall that they cause additional protein content, and also you can see that in CSF there are some glucose molecules are present. I already know that in CSF some glucose molecules are present, but those glucose molecules are consumed by this bacteria, so that this bacteria can get their nutrition. So why the glucose content in the CSF fluid of the patient reduce because that is glucose. So here molecules consumed by the bacteria, and this bacteria consume these glucose molecules in order to get nutrition. So see that acute pathogenic meningitis caused by bacteria, and this bacteria present in CSF fluid and require nutrients for their survival, and this bacteria consume glucose molecules present in the CSF fluid, and with the consumption of these glucose molecules, the glucose content in CSF fluid of the patient is less than the normal range. See once. So this is a normal glucose content in CSF, and this is the glucose content in the CSF of CSF fluid of the patient, and this is the normal glucose content in the CSF fluid. So now see that the number of cells in CSF fluid of the patient is 5000 neutrophils per microliter, but normal number of cells in CSF fluid is 0 to 4 lymphocytes per microliter. So normally in the CSF fluid, that is, no neutrophils are found, but in the CSF fluid of the patient, so here neutrophils are found. Why? So as you already know that this, so here that is bacteria that they cause infection of the brain, and as a result that is meningeal inflammation also occurs. So therefore that is bacteria also present in CSF. And you also know that whenever that is a bacterium that is attacks our body, then the first primary immune cell to get activated in order to fight against the bacteria, and that first immune cell is the neutrophil. So therefore that neutrophils move towards the CSF fluid where bacteria are present in order to fight against the bacteria. So this is the reason what I have written there. In acute pathogenic meningitis, the bacteria cause infection in brain, which is a part of CNS, and in response to this infection, meningeal inflammation cause. And in case of bacterial infection, the neutrophils are the first immune cells to get activated and to do fight against the bacteria, and these neutrophils reach CSF fluid. So therefore that these neutrophils are found in the CSF fluid, because that these neutrophils have to travel to the CSF fluid where bacteria are present in order to fight against the bacteria. So due to this reason also neutrophils found in the CSF. Now the next region, that is causative organism found in CSF, is definitely that is bacteria which cause. So here that is acute pathogenic meningitis, they are present in CSF and they are present. So therefore that is causative organisms are the bacteria causing infection in the brain, and they are found in the CSF. But normally in CSF that is no causative organism is found, it is completely sterile.